Hi guys, sorry that I didn't put a video up for you on Monday. It's been a pretty mad couple of days over here. I hope everyone had a great weekend. Hope your week's going well. What I wanted to do today was do something a little bit different and kind of go back to basics, if you like. So one of the most important things for somebody who has back pain to know is the difference between acute pain and chronic back pain. Okay, so they're two different types. Sometimes people think that the word chronic is like a description of intensity, like, oh, pain was chronic, you know, thinking it means that it's really, really severe. That's actually not what the word chronic means. They're both, those two words, acute and chronic, are time references. So it's important to know, because if you know what sort of pain you're dealing with, then it alters how you're going to manage it. And actually, for me personally, it alters how I feel about the symptom that I have. So acute pain first, right? Acute pain is the kind of pain you get that is associated with tissue injury. All right, so we say that this kind of pain is correlated with tissue damage. So that's the kind of pain that you get if you cut your finger on something, right? Cut your finger. You know there's a cut. You can make like a paper cut. You can see the gap. There's maybe a little bit of blood. All right, we know there's damage there. We feel the pain. There's a direct relationship between those two things. All right, for most of you guys, that will be the sort of pain you had the very first time you hurt your back. Now, acute pain lasts for 12 weeks as its kind of whole time frame, right? And it typically tapers off. So you'll start off day 1 here, right? Loads of pain. End of week 12 here. The pain should go like this. And it comes all the way down to the end, pain's gone. Okay, so what's happening between there and there is your body is healing. Okay, so it's not a case of the pain's just going away. The pain is going away, but it's going away because the tissue damage has healed between here and here. So pain starts really high when you first injure yourself, and it tapers off until we get down to end of week 12. Tissues have healed, pain's gone away. Okay? So chronic pain. Why is chronic pain different? Well, chronic pain is not associated with tissue damage. So that means that this type of back pain is the pain you have when it's more than 12 weeks old. Okay, so the tissue is healed, but you're still experiencing back pain. And chronic pain is more associated with sensitivity of your nervous system. So what that means is if you've got chronic back pain, and it's more, for example, it's more painful when you bend forward, what's happening, because your nervous system is so sensitive, it's saying, when you're bending forward, which is a completely normal thing to do, it's saying, I don't want you to do that. Please don't do that. And it's giving you the pain to try and stop you from doing it, because it thinks that something bad might happen if you bend forwards, okay? Now, that's very, very normal when you first injure yourself. I did a video in the summer when I tore my hamstring. Literally every time I tensed my hamstring or even leant forward in the chair and put a little bit of tension in it, I had this sharp, like, stabbing pain in the back of my leg. That was normal at that point, okay? So it's when there's definitely some form of tissue damage, when we're confident there's tissue damage, so short term, that protective pain to stop you using it is normal, all right? As you recover, that should calm down. But in chronic pain, the fact that it doesn't calm down means that your body's protective response, which is pain, is firing is too intensely, okay? So what I want you to do, a little analogy for you. So imagine you've got a guard dog. One night, people try and break into your house, dog barks, goes crazy, trying to wake you up. It's letting you know that there are people breaking in. That's acute pain, all right? So there's a definite thing happening. The people are trying to break in. The dog's reaction is representing the pain. It's happening in response to people trying to break in, okay? But now, imagine that happened years ago, and now every time the dog hears a noise outside, it goes mad, trying to tell you that there's people breaking in, and there isn't, okay? That is what chronic pain is. So your body is trying to protect you from a threat that isn't necessarily real. Pain is real. You are definitely feeling that. I am not telling you that it is in your head, okay? That is not what we're here to do. Pain is definitely real, and it's definitely a real experience for those of us. I mean, as you know, I've experienced that before, so I know that chronic pain is a real experience, but the threat that leads to the pain has gone, okay? So that's the best way to explain chronic pain to you. It's an oversensitive, overprotective nervous system trying to alert you to a potential threat when the threat has passed. So what that means is it's giving you a protective response when you pick up your socks, for example, when you bend down to pick up your socks, rather than if you try and pick up something that's far too heavy and you injure your tissues, for example. All right, tissues in your back. Now, we don't know why people get chronic pain. Okay, so there's about 80% of people will get back pain at some point in their lives. Most of those people will recover within the 12 weeks. Okay, so if they injure the back on day one, by the end of 12 weeks, about 80% of people have got better. About 20% of people don't have their pain fade off within 12 weeks. Okay, about 20% of people have their pain continue on after those 12 weeks. So rather than the pain starting here on day one and finishing here at the end of week 12, it kind of goes down. It goes like this. All right, and then it carries on. Now, one of the factors so we don't know specifically why that happens, but we can see some things that can make it more likely to happen. All right. One of the things is just having a phenomenal amount of pain on day one. So high pain intensity on day one means you're more likely to be experiencing pain or higher level of pain. A high level of pain on day one means that you're more likely to be experiencing pain past the end of week 12, so making it into chronic pain. All right. Another reason might be that you experience some kind of psychological distress during that acute phase between day one and the end of week 12. You're experiencing psychological distress during that time. All right. So the reason you need to know this is because we just see so many patients who think that there's damage in their body that has never healed, or they say, it's lasted. There's damage in there that's just lasted for years, and that's seriously unlikely to be the case. What is more likely is that your body hasn't turned off the pain, and it needs some kind of input from us to get it to calm down again. Okay, and that's where the 3 M's come in that we've spoken about. For those of you in the spinal recovery program will know about that. That's mindset, movement, and mindfulness. On a little side note, which you might find interesting if you're sad like me, you might not if you're a regular person. On a side note, this is why the research says that X-rays and MRIs aren't really very helpful at all for people who have pain that is more than 3 months old. Because if there was damage that occurred when you had an injury, then by 12 weeks, it's healed. All right. So if your pain is more than 12 weeks old, there is no relevant damage to see. All right, because it was there and now it's gone. And when I tell that to people, sometimes they might argue with me and say, oh, well, I want the MRI, I want the X-ray, because I want to see if there's wear and tear in the spine that could be causing my pain. If that's going through your mind, then what you need to do is go back and watch one of the first videos we talked about. One of the first videos we did where we discussed the lack of relationship between spinal degeneration, wear and tear arthritis on your X-ray or your MRI and the pain that you feel. The correlation there is very, very poor. Now, I'm sorry, I know it's a long video. The other component of acute and chronic pain that we need to discuss are flare-ups. All right, so where does a flare-up sit? Because it's the same pain you've been experiencing for years, but it's happened recently, so it's less than 12 weeks old. So it's kind of acute and kind of chronic. All right, so I would just say that it's an acute flare-up of a chronic problem. So we've spoken about this before. You don't cure chronic pain. You just use strategies in your day-to-day life to stop it from bothering you all the time. But it is possible for pain to come back even if you've not had it for ages. Okay, and that's all a flare-up is. I've gone phases where I've gone like over a year without really experiencing any kind of back pain at all. But when I get the back pain again, it's not that I've re-injured it. It's just that I'm flaring it up. It's an acute exacerbation of a pre-existing problem. All right. The best way, I tend to, with my patients, I talk about how I think of chronic pain as a journey of good days and bad days. Chronic pain kind of puts you on a slightly different path, and a flare-up simply represents a bad phase of that journey. Okay. Now, that is me done. There's quite a lot in this video. My advice would definitely be to go back, watch it again, get to grips with it all. Differences between acute and chronic, about the time frames, about how your body will always heal within 12 weeks. it's quite a tricky one to get our heads around, but this is super important because this can shape how you think, how you feel, how you behave with your back pain going forwards. So I hope you guys all found that useful. I'll catch up with you all next time. If there's any recommendations at all, then let me know. If you're fed up with seeing some homeless looking bloke on your on your group doing videos, then also tell me that. Have a great day, and I'll catch up with you next time.